Body dysmorphia is unfortunately super common to have comorbid alongside BPD. Having an unstable sense of self, self image, perception of self, just overall how we see ourselves, not only internally but definitely externally, can have a huge impact, resulting in body dysmorphic disorder. It can be very challenging to see ourselves clearly at all. And according to this study done through PubMed, the prevalence of body dysmorphia alongside BPD with childhood trauma is extremely high. So they conducted a study using various comprehensive assessments amongst 70 people with BPD and 70 patients with healthy controls. Using a variety of mechanisms and testing evaluations, the results came in at a not so shocking 54.3% in the borderline sample of having body dysmorphia. And this result doesn't shock me that it's so high, as it's thought that both of these disorders, at least partly, share a common psychopathologic mechanism. It's not known what actually causes body dysmorphic disorder, but it is thought that it's a combination of issues, like family history of this disorder, negative experiences about your body and self-image, abnormal brain function, etc. It's essentially a condition where you just cannot stop thinking about perceived flaws and you hyper-focus, hyper-analyze on these things. And when you have body dysmorphia, you do very repetitive behaviors such as checking yourself in the mirror, grooming, or seeking reassurance, sometimes for hours each day. These repetitive behaviors can cause a significant impact on your daily functioning in a negative way. You may seek out numerous cosmetic procedures to try to fix perceived flaws. And there's usually a temporary feeling of satisfaction until those body dysmorphic thoughts come back into the mind and, the next one is being sought after. Here are some signs and symptoms of body dysmorphic disorder. So again, being extremely preoccupied with a perceived flaw in appearance, strong belief that you have a defect in your appearance that makes you ugly or deformed, belief that others take special notice of your appearance in a negative way or mock you, engaging in behaviors at aiming, fixing, or hiding the perceived flaws that are difficult to resist or control, frequently seeking reassurance about your appearance, having perfectionistic tendencies, seeking cosmetic procedures with little satisfaction, and avoiding social situations. And these behaviors aren't wanted. It's repetitive and gets in the way of daily life and daily functioning, even simple things. And you may tend to excessively focus on one part of the body versus the other. There's a list below, such as the face, things to do with the hair, skin and vein appearance, etc. When to see a doctor? Well, the shame and embarrassment about your appearance may keep you from seeking treatment for body dysmorphic disorder. But if you have any of these symptoms, it's usually time to see a doctor and speak to a healthcare professional. Body dysmorphic disorder doesn't usually get better on its own, as stated below. If left untreated, it gets worse over time and can lead to other more horrible sort of effects. And unfortunately, these thoughts become very common. And this disorder typically starts in teenagehood, but there are certain risk factors of developing or triggering body dysmorphia, such as having blood relatives that have it as well, or have OCD-like tendencies when it comes to their body. Negative life experiences such as childhood teasing, neglect, or abuse. Certain personality traits such as perfectionism, societal pressure, or expectations of beauty, definitely very relevant. Having other mental health conditions such as anxiety or depression, yes. And there's quite a few complications that come with this disorder. It's not so small or so minute. Low self-esteem, major depression, or other mood disorders, the S thoughts or behavior, anxiety disorders, including social phobia, obsessive compulsive disorder, eating disorders, substance misuse, health problems from behaviors such as skin picking, physical pain or risk of disfigurement due to repeated surgical interventions. Unfortunately, there's no known way to prevent this disorder, but early intervention, awareness of what you're dealing with, as well as seeking long-term help can really help. Having body dysmorphia does warrant treatment from a healthcare professional, but there are definitely things that you can do yourself at home, etc., to make life a bit easier. So, sticking to your treatment plan, don't skip therapy sessions. If you stop, the symptoms can come back, just like stopping a medication too early. And learning about this disorder, as well as understanding it, can help motivate you to continue with your treatment plan. Practice learned habits that you've learned in therapy. Avoid drugs and alcohol. Of course, these things can worsen the situation. And getting active, physical activity, exercise can help manage symptoms and reduce them potentially. Things like walking, jogging, swimming, but it also says to note to avoid over hyperfixation with exercise as a way to deal. With body dysmorphia, it's way too easy to let things get to the extreme, one end or the other. And you can talk to your healthcare professional about ways to improve your coping skills and ways of focus on identifying, monitoring, and changing the negative thoughts and behaviors about your appearance. And here's some more tips. So, write in a journal. This can help better identify the negative thoughts, emotions, and behaviors. Don't become isolated, so trying to participate in social activities regularly, get together with friends and family who can act as healthy supports. Take care of yourself, eat healthy, stay physically active, and get sufficient sleep. Easier said than done, of course. And joining a support group where you can connect with others who are facing similar challenges. And it's important to stay focused on your goals. Recovery is not a quick process. It is long-term and ongoing. So by staying focused on your goals, it will help you stay motivated by keeping the recovery goals in mind. Learning relaxation and stress management techniques is also really important. And to not make important decisions when you're feeling in distress or despair. You may not be thinking clearly and may regret the decision you made later. And here's some extra resources in case you need them. Dealing with body dysmorphia is not easy, and the mental and physical, spiritual anguish and toll that it takes can really mess us up and bring us to make some decisions that, in hindsight, we don't want to make. For me, I try to remind myself that these days where I feel I don't even know what I look like, I'm very confused, I'm overwhelmed, I'm flustered, mentally all over the place regarding my appearance, and then, it bleeds into other things. I try to remind myself that these days will come, but they will also go, that these feelings won't last forever. And by reminding myself that, the sense of panic can reduce, so therefore not making irrational decisions. It may go down a bit. Sending you all lots of love, and please know that you're not alone in how you feel.